Hi friends, hope you're doing well. I'm Dr. Milind. So recently we got news that NEET PG 2022 was deferred, and it is just adding to the frustration that the counseling is not happening because so many students are waiting for counseling to happen so they can decide on their future. Also, there are students who did not get a very good rank in last exam and were thinking that they want to prepare, but the recent counseling process is also adding confusion to their minds. There are students who are not happy with the branch that they will get. Some students who have a good rank, but still they are thinking I can do better. So all of these students, they're very confused that which exam to target, because there is no news about the next exam or the NEET PG that is going to happen next year. So I have always said in my old videos, there is one exam that is always certain, and you should always give your best for that exam, and that is INICET. Because AIMS exam that used to happen earlier in JIPMER and INI, that will always happen on time, and a lot of students had confusion whether it will happen or not because of the next that is coming. So finally, we have this notification by AIMS, and the exam is going to happen. We have official notification, and registration is going to start from tomorrow. So that is 5th of September, and the window will be open till 26th of September. So we have this exam and we have the date, and the date of the exam is, as it was declared earlier, 13th of November 2022. So we have roughly 2.5 months for two and some more days for the exam. So I just want you all who really want to fulfill their life, don't take INICET, like don't feel that you will not be able to crack, or it's a difficult exam, or I just want to write NEET or NEET PG. This is also the exam where you can crack. You just need a basic preparation, and I have released videos and I have released strategy also recently about an exam which you can go through. So I have recently, I had given super specialty exam of INI as well, of NEET as well, and I have been following the exam pattern that has been releasing. What I'm seeing, see, there are two types of questions that are asked recently. The exam pattern is completely changed, but what I have noticed that there are two type of questions. First is there are a lot of previously asked questions, so you don't notice because you don't solve them. So I have seen that some questions they were asked like 5 to 8 years back, they are coming as one line. So you have to do previous year questions. Again, I am re-emphasizing on the same point. Do at least last 5 to 8 years time. Like 5 to 8, why I'm saying this range, that if you have theory should be your baseline. But if you have some extra time, you can do additional 3 years. 5 years is must. If you can do last 8 years, AIMS, INI, JIPMER, these questions are must. And you'll tell me after your exam that a lot of questions were came which were asked earlier. Second group of questions is clinical based questions. A lot of they are asking the simple questions, but they're framing it in a clinical pattern. That instead of asking what is the most common cause of certain disease, they are giving the disease that you have to diagnose. Okay, this is the part. For that, you don't need to solve any Q bank, or you don't have to waste time on it, because you have to read your theory well. If you know your theory well, if you know the disease well, if you know the condition well, you'll be able to tackle those clinical questions. You just need a little bit practice of MCQs just to integrate these knowledge to whatever you have read. So work more on, for especially for INI, my message is focus on your basic sciences. Do your first and second prof subjects well. Make your theory your baseline. Don't read anything apart from your notes, and do lots and lot of PIQs, and that will definitely help you get you through. So guys, we have an exam date and we have this exam. And one more point that I want to add, earlier aims was there was only one aims. I always say that there are new colleges coming. So if you're someone who is looking after medicine branch like medicine pediatrics, they don't need a lot of infrastructure. You can have good number of patients and all. So if you're someone looking for such branches, so definitely there are a lot of aims. Earlier there were only 6 aims, but now we have Batinda, Deoghar and Mangalagiri, which also will be recruiting students through this exam. And we have Jipmer and Nimhans and PJ as well. So there are a lot of seats for grab. There are, everybody is going through confusion. If you're feeling distracted, if you're getting affected by the delay in the counseling and all these things happening around, you are not the only one. The student who is going to stay focused and just concentrate on your preparation, irrespective of what is happening around, will get through. So do just focus on your exam, and you have a very good chance this INI and this exam, that definitely any average, any student, what kind of students, if you are a average Indian medical graduate, a foreign medical graduate, or a private medical student, does not matter. There are a lot of students who have done it. So just have faith in yourself, start preparing, and you have these 2 good months for it to make your dream come true. So I wish you all the best and take care.